Hi, I will be presenting on GERD, or gastroesophageal reflux disease. Patient TE, a 67-year-old male native Hawaiian, presents to Bay Clinic Hilo on February 27 at 9:30 a.m. for medication management. Patient reports no symptoms of heartburn, GI distress, upset stomach, stomach pain, or difficulty swallowing. Patient has been diagnosed with the following conditions: GERD, hyperlipidemia, hypothyroidism, and vitiligo. For family history, patient's mother is currently alive. As far as any family history of cancer, CVD, or premature death is concerned, information was unavailable. TE is a current smoker who smokes 4 sticks per day for about 40 years, equivalent to 8 pack years. He is currently single with no children, and he lives with his disabled mother, of whom he provides primary care. Patient denies illicit drug use and alcohol use. He does, however, enjoy drinking coffee, preferring his coffee black as well as hot chocolate. As far as diet is concerned, TE mainly enjoys eating stir-fried food and soup. TE claims to regularly exercise at least once a week, and information regarding his work setting, sexual activity was unavailable. TE is currently up to date with his immunization records, with his last flu shot received on September 2011. For negative findings, patient denies symptoms of palpitation, tachycardia, headache, difficulties breathing, or increased heart rate. As mentioned above, patient also denies heartburn, GI distress, upset stomach, or difficulty swallowing. He also denies congestion. For positive finding, patient is more energetic as opposed to being tired and sleepy. He does report experiencing runny nose and sneezing when fog is present in Hilo. In addition, patient reports weight gain and weight loss, which has been consistent over time. Overall, patient appears happy, healthy, and well-nourished. For medication adherence, TE has been consistently taking his medication as prescribed. For vitals, patient presents to the clinic with a BP of 126/74, a heart rate of 72, respiratory rate of 18, temperature normal, a weight of 193.8 pounds, and a height of 5'11". His IBW is 75.3, his BMI is 27, considered overweight. His basal energy expenditure is 1,726 kcals per day. His creatinine clearance is 64.7 milliliters per minute. His transaminases levels are within normal limit, and his BMP is also within normal limits. As far as his lipid panel, however, patient has elevated cholesterol and LDL, but his TSH levels are consistent and within normal limits. Patient has no known drug allergies, and his current medication regimen includes cimetidine, levothyroxine, and aspirin. Risk factors associated with GERD include drugs such as anticholinergic, aspirin, beta-2 adrenergic agonists, calcium channel blockers, nitrates, NSAIDs, and TCAs. Dietary food include fatty food, spicy food, chocolate, caffeine, or carbonated beverages. For lifestyle, includes cigarette smoking, obesity, supine body position, and tight-fitted clothing. For medical surgical conditions, risk factors include pregnancy, scleroderm, and gastroparesis. TE is positive for 5 risk factors, which include aspirin use, chocolate and caffeine consumption, cigarette smoking, and obesity. TE has a risk score of 16%, and his vascular age is 46 years. For current therapy, TE requires continued treatment of his GERD in order to provide symptomatic relief, as well as to prevent any future esophageal damage and complications. Per AGA guidelines, empiric treatment for GERD includes acid suppression therapy. Current acid suppression pharmacologic therapies include H2 receptor antagonist and proton pump inhibitors. AGA guideline recommends the use of proton pump inhibitors over H2 receptor antagonists, given that PPIs are more effective than H2 receptor antagonists. TE is currently on an H2 receptor antagonist, cimetidine, at 400 milligrams 1 tablet taken at bedtime. Drug and dose is appropriate for the patient since it provides symptomatic relief. Patient reports no side effects associated with the use of cimetidine and instead expresses great satisfaction with his medication. Therapeutic alternatives for the treatment of GERD include the following: proton pump inhibitors and promotility agents. Promotility agents such as metoclopramide and betanicol are an alternative treatment for symptomatic relief of GERD. However, promotility agents are not recommended as monotherapy for patients with GERD since they are not as effective as acid suppression therapy. Undesirable side effects such as extrapyramidal effects, sedation, and irritability are commonly associated with promotility agents. Furthermore, combination of promotility agents with acid suppression therapy provides only modest improvement in symptoms as opposed to standard H2 receptor antagonist therapy. In addition, routine use of combination therapy has no role in maintenance therapy per ACG guidelines. Proton pump inhibitors, on the other hand, are recommended as first-line treatment per AGA and ACG guidelines. Advantages of PPIs are that they are more effective in providing symptomatic relief and healing of esophagitis in patients with GERD as opposed to H2 receptor antagonists. Also, PPIs are more cost-effective and can be used for long-term maintenance therapy with less recurrent symptoms compared to H2 receptor antagonists per AGA guidelines. Disadvantages of PPI are mainly due to side effects such as headache, diarrhea, constipation, and abdominal pain. For medication interactions, patient has no potential medication interaction. Recommendation for drug therapy. For patient TE, despite ACG and AGA guideline recommendations for PPI as first-line treatment in GERD, I would recommend that he continue his cimetidine or H2 receptor antagonist. Patient expressed great satisfaction with his medication and routine use of medication, also displaying hesitancy to switch medications to a proton pump inhibitor. Switching to a different class of medication may potentially decrease patient compliance, resulting in undesirable adverse effects. I also recommend that cimetidine be tapered off to the least effective dose when possible. However, if TE experiences frequent relapse in symptoms, or if he experiences dysphagia, I would recommend that symptoms be monitored and his H2 receptor antagonist be switched to a proton pump inhibitor, since PPIs are more effective in preventing remission as opposed to histamine 2 receptor antagonists. For medication reconciliation, there is none to discontinue. Recommended drugs to consider avoiding dependent on patient-specific parameters: concomitant use of clopidogrel, delavirdine, dofetilide, or other drugs which may increase the effects of these drugs include amiodarone, anticonvulsants, benzodiazepine, and CYP1A2, 2C19, 2D6, and 3A4 substrates, theophylline, warfarin, phenytoin, nifedipine, and propranolol. Drugs to consider avoiding which may have decreased effects include atazanavir, cefuroxime, and ketoconazole. For recommended tests, there are no recommended tests as of the moment. However, when patient returns to the clinic, I would like to follow up in his work setting, sexual activity, and any family history of premature death or coronary vascular disease. For goals, our goals for TE is to continue to alleviate or eliminate patient symptoms, decrease frequency of recurrence and duration of GERD, and to promote healing of injured mucosa, as well as to prevent the development of long-term complications. For monitoring parameters, we would monitor for efficacy, such as reduced recurrence of symptoms which include heartburn, hypersalivation, regurgitation, upset stomach, stomach pain, sour taste from stomach, and so on. Drug-related side effects to monitor for include headache, somnolence, fatigue, dizziness, constipation, or diarrhea. Patient counseling. Hi TE, you're doing a good job with taking your medications consistently. Please tell me, what medication are you taking for your heartburn, chest pain, or upset stomach? That's good. You're taking cimetidine 400 milligrams orally every hours of sleep. What do you do if you miss a dose? If you miss a dose, take your missed dose as soon as possible. But if it's time for your next dose, you can go ahead and skip that missed dose and take the next dose you're scheduled for that day. How will you store this medication? Yes, this medication should be stored away from sunlight and moisture and away from the reach of children. Please do not crush or chew your medication, and take your medication every day, even if you feel better. TE, do you take your medication on an empty stomach? This medication is best taken with meals. What you can do is take this medication together with dinner if that works for you. What I want you to look out for are side effects associated with this drug, which include black stool, abdominal or chest pain, or confusion. When you experience these side effects, you should contact your doctor. Also, please monitor if this drug is working for you. You will know if it's not working for you if you experience any of the symptoms you've experienced in the past with your heartburn and chest pain and upset stomach. If you experience any of these symptoms, please contact your doctor as well. Also, I want you to track down when and what you ate or did when you experienced those symptoms. You can write them down in a journal or notebook so you can provide the information to your doctor, and possibly what you did or ate may be associated with those symptoms. TE, there are some changes you can also do to prevent symptoms from coming back. I know you enjoy your caffeine and chocolate drink at night, but this may cause your symptoms to come back. Smoking is a big no-no, not only for your overall health and well-being, but also because it may cause your symptoms in stomach or chest pain or heartburn you're feeling. Also, please avoid foods that are fatty and spicy, because these may also cause the pain you're feeling. Avoid lying down after you eat, and when you sleep at night, you can try to elevate your head with a pillow, and this may help alleviate or reduce your symptoms at night. Your weight is also considered on the heavier end, and I would recommend that you incorporate fruits and vegetables into your diet. Also, I would recommend that as much as possible, try to incorporate exercise into your daily routine. To quit smoking, Hawaii has a tobacco quit program where you can call 1-800-QUIT-NOW. Also, TE, this is a handout printed for you containing information about your medication. Thank you and have a nice day.